Welcome to This Explainer. Today, we're tackling a massive internet health trend, and we're using a really rigorous JAMA Network open randomized clinical trial to do it. We're going to look closely at a medical hypothesis that completely bypassed the clinic and just went incredibly viral. Thousands of people online were swapping protocols, literally clamoring for this so-called miracle cure long before the actual science could catch up. But as you'll see, this viral hope eventually clashed with the cold, hard reality of the scientific method. Okay, let's dive right into this incredibly seductive idea that a standard antibiotic pill could somehow end years of debilitating spinal pain. I mean, if you've ever scrolled through health forums or Reddit threads about chronic pain, you've definitely seen the rumors spreading like wildfire. People were desperately asking, can a grueling 90-day course of antibiotics actually cure my herniated disc? Think about what that really entails, right? Taking a heavy-duty antibiotic twice a day for 3 solid months, fundamentally altering your gut microbiome, all in the desperate hope of fixing a mechanical spine issue. It sounds like magic. But in medicine, miracles absolutely need data to back them up. Section 1. The back pain epidemic.
So we really can't understand why this internet rumor caught fire without first grasping the sheer scale of the global back pain epidemic. The data tells a really sobering story here. Low back pain is literally the greatest cause of disability burden worldwide. And look, disability burden doesn't just mean a temporary ache from a bad night's sleep. We're talking about millions of lost careers, severe psychological impacts like depression, and just a staggering economic drain that costs healthcare systems billions every single year. Because traditional evidence-based treatments, things like physical therapy, standard pain meds, and just time, fail so frequently, patients are often left in a really dark place. They're looking for a lifeline, and well, desperation naturally makes us highly susceptible to unproven, hyped-up treatments.
To put this into perspective, the patients in this specific study weren't just dealing with a tweaked muscle from a weekend workout. They had been suffering from severe chronic pain for an average of a decade, 10 whole years. Just imagine a decade of daily, unrelenting agony radiating from your lower spine, impacting every single time you bend down, sit at a desk, or even just try to sleep. That was the baseline reality for the 170 participants who signed up for this trial. They were exhausted, vulnerable, and completely ready to try absolutely anything that offered even a glimmer of hope after years of dead ends.
Section 2. The Antibiotic Hypothesis.
So how on earth did a medication strictly designed for bacterial infections become the most buzzed-about treatment for a mechanical spine issue? Well, the rationale wasn't completely out of left field. Earlier, much smaller studies had suggested that when a spinal disc herniates, low-virulent bacteria might actually enter that space. Now, these aren't the aggressive superbugs that give you a massive, immediate fever. They're sneaky, slow-growing microbes that allegedly slip into the discs and cause painful, smoldering microinfections over time. A 2013 trial actually showed some dramatic improvements using antibiotics to target these, while a later trial in 2019 showed zero benefit. And it's exactly this wild conflict in the scientific literature that fueled the massive ongoing internet and social media hype we're looking at today. Now, this very heavily targeted a very specific subgroup of patients, those with modic changes. Essentially, modic changes are bone edema, so swelling and inflammation inside the actual vertebrae that show up really clearly on an MRI scan. Proponents of this antibiotic cure believed that these specific inflammatory changes were the ultimate smoking gun. They argued this was definitive visual proof of a hidden bacterial infection inside the spine. So if you had modic changes on your MRI, internet forums were basically promising that you were the prime candidate for this antibiotic miracle.
Section 3. The Ultimate Lie Detector. To settle this raging internet debate once and for all, researchers set up a community-based, double-blind, randomized clinical trial with 170 participants. They desperately needed an experiment so watertight that absolutely no one could argue with the results. Half the participants got amoxicillin clavulanate, which is a heavy-duty, broad-spectrum antibiotic designed to aggressively wipe out those specific low-virulent bacteria we just talked about. The other half? They received a microcrystalline cellulose tablet. And the researchers went to extreme lengths here. The fake pill was meticulously manufactured to be entirely indistinguishable in size, color, and coating from the powerful antibiotic, setting up a truly fair fight. Neither the patients nor the doctors had any idea who was getting what.
What makes this study even more incredible is the context it happened in. It actually took place during severe COVID-19 lockdowns in Victoria, Australia. Researchers had to rapidly adapt and use strict telehealth protocols just to keep the trial running safely.
The sheer dedication of the Monash University team here is just fantastic. They managed to maintain pristine data collection, conducting incredibly rigorous telemedicine follow-ups, and coordinating complex assessments, even when the rest of the world was effectively shut down. They absolutely refused to let a global pandemic compromise the integrity of this crucial trial.
Section 4. The final results.
Okay, so after meticulously tracking these participants for an entire year, the researchers finally unblinded the data. This is the moment of truth, right? Did the 90-day antibiotic regimen actually work? Well, looking at the data for pain intensity, the dark antibiotic line and the lighter placebo line track almost perfectly together. They showed a statistically insignificant adjusted difference of just zero point 0.06 points at the 12-month mark. Put simply, on a 10-point pain scale, a difference of 0.06 is completely meaningless. You literally wouldn't even feel it. The placebo group actually experienced a slight natural reduction in pain over the year, and the antibiotic group did no better. The highly anticipated internet miracle simply wasn't there. And the data concerning disability scores reveals the exact same disappointing truth. The antibiotic provided no greater reduction in disability than the completely fake pill. Whether measuring how chronic pain interfered with simple daily tasks, like, say, bending down to pick up groceries, or tracking major life impacts like missed days of work, the outcome was completely identical. The group taking the heavy, broad-spectrum antibiotic for 90 days had absolutely zero functional advantage over the group taking the simple sugar pill. They were both equally disabled by their back pain at the end of the year.
Now, for the final nail in the coffin of this internet theory, remember those smoking gun modic changes we talked about earlier? The very patients the internet absolutely guaranteed would be cured? Well, the researchers ran a pre-specified subgroup analysis just for them. And the result? Exactly the same. Even these absolute perfect prime candidates found zero relief from the antibiotics. The medication failed to beat the placebo across the board, completely and permanently dismantling the core argument of the entire online hype train.
Section 5. The hidden dangers. Now, if the only problem was that these pills just didn't work, we could probably shrug and move on. But taking antibiotics unnecessarily comes with a really steep medical cost. The harm profile here was incredibly stark. A massive 40% of the antibiotic group suffered adverse events, with nearly 17% having to stop the medication entirely due to unbearable side effects. We are talking about severe diarrhea, intense allergic reactions, and massive gastrointestinal distress. The people taking the actual antibiotic were suffering from real, documented physical harm from a pill that was doing absolutely nothing to help their spine.
And the risk extends far beyond those immediate stomach issues. To put it into a broader perspective, the World Health Organization estimates that a staggering 5 million deaths per year are associated with drug-resistant bacteria. Think about that number for a second. That is a massive global threat, and it's fueled directly by prescribing antibiotics when they simply aren't needed. Every single time someone takes a 90-day course of broad-spectrum antibiotics for a mechanical back issue, they are actively training superbugs. They're helping bacteria evolve to resist medicine, meaning when we actually need those antibiotics to fight off a lethal, life-threatening infection, they might no longer work. The authors of the study leave us with a deeply serious mic-drop conclusion, putting a firm end to the hope that a simple antibiotic is the magic bullet for spine pain. The data is in, it's definitive, and it dictates a complete halt to this specific medical practice. Clinical guidelines can now definitively state, do not prescribe antibiotics for chronic low back pain. The science firmly directs us to prevent their inappropriate and, quite frankly, downright harmful use in this patient population.
As we wrap up this explainer, it really leaves us asking a critical question. How can we better protect ourselves and our global health when viral internet cures so often clash with cold hard science? Look, when you're suffering from decades of chronic pain, any promise of a cure looks like an absolute lifeline. But as we've seen today, structured, rigorous science is the only true way to separate genuine breakthroughs from harmful illusions. So keep asking questions, always look closely at the underlying data, and I'll see you in the next explainer.